I have to say I'm privileged and honoured to be sitting here next to Jan Roberts, an Australian leader in fertility. Jan Roberts is a pharmacist, a clinical nutritionist, and a best-selling author. Jan, welcome, and tell us a little bit about yourself.
Gee, Wade, that's one hell of an introduction. Thanks. I have to say my pharmacy career started right back in 1967, so I've been on this trail a long time. 15 years in community pharmacy, but frustration with what I saw as band-aid medicine led me to a diploma in clinical nutrition. That was right back in 1982. And while I was doing that, I heard of Foresight, and they are the UK-based association for the promotion of preconceptual care. And it was their work that prompted all the preparation I did before my own 2 pregnancies, which I must say were quite late in my reproductive life. But it was the benefits that I saw that inspired the work I've done for the last 30 years. And that has been promoting preconception healthcare as the way to improve fertility, to prevent miscarriage and other reproductive problems. But most important, preconception healthcare is the logical, elegantly simple way to ensure a really beautiful, bright, happy, healthy baby.
Yeah, well, that sounds like something that's vitally important today when we see so much infertility, so many miscarriages, premature births, and kids with, asthma, allergies, ADHD, and so on.
You've summed it up. Never been more important. Infertility rates are on the rise. 1 woman in 4 will miscarry. Labours are frequently much too long and they require medical intervention, and breastfeeding periods are much too short. And we have an absolute epidemic of kids with those subtle and not so subtle health issues, and this represents an extremely inauspicious start to family life. And of course the cost to the community and to healthcare systems is impossible to quantify.
Yeah, there's no doubt about the cost to the community. But Jen, another concern is with the increasing rate of reproductive problems with so many kids with these various health issues. They come to be accepted as the norm. But you're saying we can do something to reduce these statistics.
I sure am. And the story starts before conception, and it starts with both prospective parents. They're in this quest for a really healthy baby together. So I want to make that clear. This isn't about an IVF specialist or an obstetrician or a midwife or the hospital delivering your perfect baby. And it's not about ultrasounds or other prenatal diagnostic screening ensuring the 100% product.
Oh, okay. So, Jen, you're saying that the system can't be held responsible for ensuring optimal health babies. The responsibility lies with the prospective parents.
That is exactly what I'm saying. This is about the prospective mum and dad committing to giving their baby the very best possible start in life.
Well, Jen, that's really exciting opportunity for anyone who plans to become a mum or a dad at some stage.
I think so. And it's actually not really as hard as it sounds, nor is it as out there as some people seem to think. Farmers and stock breeders know all about preconception care. They would always ensure that breeding stock is optimally nourished and non-stressed. And the human population simply needs to ensure the same.
Okay, so Jan, to quote you here, you say optimally nourished and non-stressed condition for prospective parents. Can you elaborate on this a little bit for our listeners?
I'll put it in a nutshell. Preconception healthcare means an abundance of all the basic building blocks. That's vitamins, trace elements, essential fatty and amino acids, purified water, and a complete absence of anything that may be potentially toxic. Now, that's a nutshell, but it also must involve both partners equally. The program must also be completed and in place for at least 4 months before conception. So that doesn't mean cutting down on cigarettes or reducing alcohol.
Mm-hmm. Okay.
Parents must have quit all those potential toxins because sperm can take up to 116 days to form and the egg is susceptible to damage for 100 days prior to ovulation. So the bulk of what needs doing will involve the couple's own actions, but sometimes they'll need help from a practitioner.
Okay, so Jen, let's talk for a moment about the basic building blocks. Obviously the primary source of these building blocks will be whole foods and organic diet, But I mean, that's often a pretty tall order in today's society. So, what are your thoughts about supplements?
All right, well, you've summed up my mantra, which is healthy food grown on healthy soil, but you're right, that is a tall order. So while supplements can never take the place of a really healthy diet, they are essential for both partners during that critical 4-month period and for mum during her pregnancy and breastfeeding. And the reasoning is the needs during reproduction are so critical. A diet may support adult life, may be completely unable to support healthy reproduction. Time is short, and that is particularly the case for older women. And we are trying to make up for multiple nutritional deficits, which are the result of a refined Western diet, unhealthy lifestyle habits, and environmental toxicity.
Right. So it sounds to me like the prospective mum needs, a lot more than just folic acid and iron, which seems to be the standard, fare for prescribing by GPs and obstetricians.
Well, you're right, Wade. The prescribing really indicates an insufficient knowledge of nutritional needs, and those single nutrients aren't recommended. Folic acid, for example, is part of the B complex group. It never occurs alone in nature and shouldn't be taken alone. And in the case of inorganic iron, that can cause a deficiency in zinc, which is the antagonistic mineral.
Right, so zinc deficiency. Jan, I read somewhere that zinc is the most important trace element for a woman about to become pregnant. Is this true?
Well, I would say that's pretty spot on assessment of the importance of zinc. But while it's the most important trace element for the potentially pregnant woman, it's also the most widespread deficiency in the Western world. A CSIRO study showed that 67% of Australian men, 85% of Australian women receive below the recommended daily allowance. And a University of Queensland study showed that 2/3 of Australian children are zinc deficient.
Oh, wow. Well, look, Jan, we might take a quick break, maybe grab some water and listen to some more music. For all those listeners out there, this is Better Health, the new program that's going to be aired weekly. Just to let you all know, if you're wanting some more information, you can always hit the Pure Health Direct website, which is www.purehealthdirect.com, or send an email through to info@purehealth.com. And also, just a bit of encouragement here, the first 20 listeners that come and ask some questions and want to ask questions of Jan on Twitter, you will receive a free Better Health or Spa Life magazine. And the first 4 listeners, I've just been told, also will receive a signed copy of one of Jan's fantastic best-selling books. So we'll be back very soon.